So I hope that helps to kind of decipher a little bit between more emergent and more urgent care cases.
No, that's great, Dr. Katie. I appreciate that. I can definitely think of those different cases myself. I think regardless, we see these poor guys, they're in pain. They, they may not be feeling well. And so they're stressed, we're stressed, right?
Got it.
Do you have that kind of thought process in your head of what you tell owners of, hey, how do you prepare for this? I know not everybody's prepared, but in the moment,
we never
really are prepared, right?
Absolutely. Even as veterinarians with our own fur babies, right? We totally lose all sense of medical knowledge when something happens with our own animals. And that's because emotions and adrenaline kicks in, right? So it makes perfect sense that people come to us or call us and contact us extremely stressed and very emotional. And so a few things that I like to recommend to pet owners that they can do before something like this occurs, and be prepared for that is, one, like we've already talked about, establishing a relationship with a great general practitioner or a general practice veterinarian, making sure that your pet is being seen either annually or biannually, dependent on age of the patient and what your veterinarian recommends, your local veterinarian recommends. Because already we can sometimes you all will start to diagnose things sooner, or we can do preventative care for things like that. We can avoid these issues from happening down the line. It's also very helpful to have that relationship. So when these pet parents need guidance on, do I come to you? Do I go to an urgent care? Do I go to an ER? There's an easier way to facilitate that conversation via phone call, email, face-to-face, in-person discussion. Two, I think always knowing and having as much information that you can about local urgent cares or your local veterinary emergency rooms that are close to you, so that you know where you would be going in the general vicinity of where you would be going. Luckily, again, we have this beautiful technology to help us find those places and MapQuest places, if that's even a thing anymore. Google Maps, sorry, Google, don't get mad at me.
You're showing your age, Katie.
Print out directions. And then a lot of these facilities have, well, one, your general practitioner has a lot of information and pamphlets from them, sometimes magnets and things like that. At a lot of different boarding facilities or doggy daycares, things like that, they have a lot of different magnets that have phone numbers and addresses of the facilities. I think having that taped up onto or magnetized onto your refrigerator or somewhere close by a phone that you can reach it, or just uploading those phone numbers into your phone with addresses so that you know and can get to it as soon as possible. And then lastly, I think always having an updated copy of your pet's records available at all times. So if you go, when they come and see you, Dr. Gowell, I think requesting the records after that appointment so they can keep an updated record of having that. Luckily, a lot of our facilities are now moving towards a lot of electronic records and things like that to make it easier to email things back and forth, or to be able to see and utilize on the computer. But I think that's really important to have, because there's going to be a lot of after hours issues. That's usually when these emergencies happen, is after hours, when our general practice doctors are closed, or overnight care, or weekends when they're not available. And it's just the way the cookie crumbles. It seems to be that's the way that these really, really unstable things come about. And so being prepared with the medical records to bring to that urgent care or to that emergency hospital, so that those doctors and nurses already have a running list of your pet's history. What medications are they on? What have they been diagnosed with previously? When was their most recent blood work done? And another beautiful thing about that is sometimes that eliminates unnecessary diagnostic testing if things were very recently performed by the general practitioner. And I think that the other important part of having that running list of the medical history is when you have somebody watching your pets, pet sitters, things like that, you should always have that available to them too, as well as phone numbers and addresses of where local urgent cares and ERs are, as well as their general practitioner, so they have something to refer to.